What role do lipoproteins play in stroke risk cholesterol? Imagine your bloodstream as a busy highway system, with lipoproteins acting like delivery trucks carrying essential cargo, cholesterol and triglycerides, throughout your body. These tiny particles are vital for cell repair and hormone production, but they also influence your risk of stroke in complex ways. Understanding how they work helps us see why managing cholesterol levels is so important for stroke prevention. Lipoproteins are made up of fats and proteins, forming complexes that transport cholesterol to where it's needed and remove excess from the bloodstream. The two main types relevant to stroke are low-density lipoprotein, or LDL, and high-density lipoprotein, or HDL. Think of LDL as the bad cholesterol because high levels can lead to problems, while HDL is the good cholesterol that helps protect your arteries. High levels of LDL cholesterol are linked to an increased risk of ischemic stroke, which occurs when a blood clot blocks blood flow to the brain. When LDL levels are elevated, especially above 130 milligrams per deciliter, the risk rises. This is because LDL particles can become modified, turning into oxidized LDL or small dense LDL, which are more likely to cause damage. These altered particles tend to stick to the walls of your arteries, especially in areas like the carotid arteries in your neck. Over time, they promote the buildup of plaques, narrowing the arteries and increasing the chance of a clot forming and causing a stroke. On the flip side, HDL cholesterol acts as a protective agent. It helps remove excess cholesterol from artery walls and transports it back to the liver for disposal. Higher HDL levels, often above 50 milligrams per deciliter, are associated with a lower risk of stroke. Think of HDL as the cleanup crew that keeps your arteries clear and healthy. Triglycerides are another piece of the puzzle. These fats are stored in fat cells and used for energy, but when triglyceride levels are high, above 150 milligrams per deciliter, they can contribute to atherosclerosis or artery hardening. Elevated triglycerides can also make your blood thicker and more prone to clotting, which increases stroke risk. They often go hand in hand with low HDL and high LDL, creating a risky lipid profile. Interestingly, the relationship between triglycerides and stroke is complex. When other factors like HDL and LDL are considered, triglycerides alone may not be as strong a predictor. Very high triglycerides, above 450 milligrams per deciliter, do show increased risk, but this often reflects a broader pattern of lipid abnormalities. Now, it's important to note that while high LDL cholesterol raises the risk of ischemic stroke, very low LDL levels, below 70 milligrams per deciliter, have been linked to a slightly increased risk of hemorrhagic stroke, which involves bleeding in the brain. This suggests that while lowering LDL is generally good for preventing blockages, extremely low levels might weaken blood vessel walls or affect blood cell function, increasing bleeding risk. For stroke prevention, doctors often prescribe medications called statins that lower LDL cholesterol. These drugs have been shown to significantly reduce stroke risk, especially in people with existing cardiovascular disease. But lowering cholesterol isn't just about numbers. A complete lipid profile, including HDL and triglycerides, provides a fuller picture of your stroke risk. Ultimately, maintaining a healthy balance of lipoproteins is key. Eating a balanced diet, exercising regularly, and avoiding smoking can help improve your lipid profile. If medication is needed, your healthcare provider will tailor your treatment to your individual risk factors, aiming for optimal cholesterol levels that protect your arteries without increasing bleeding risk. Always consult your doctor for personalized advice, because managing cholesterol is a vital part of reducing your chances of stroke and keeping your brain healthy.